Medicare has many parts, A, B, C, D. This video addresses Part B, the second in a series of 4. Welcome, I am Martin Bruce, your medical bill whisperer. A previous billing manager turned patient advocate, I am committed to bringing answers, insights, and solutions to patients like you. Today, let us address what Part B covers and at what cost to you. What are exceptions and limits to be aware of? And as always, I'll share some tips to help you along. But first, those of you with a Medicare Advantage plan, be aware that although your policy must offer the same services, special coverage rules will apply. In my video on Part A, we saw that Part A covers services considered inpatient or facility. This means hospital, skilled nursing facility, hospice, and usually that the patient is incapacitated or in some form of an institution. On the other hand, Part B covers mostly what are considered professional services, meaning those of individuals. These individuals may be treating you in a hospital, but are not its employees. These are the primary care physicians, specialists, therapists, mental health clinicians, nurse practitioners, physician assistants, and other professionals with some form of a medical license. Part B covers their services whether in a facility, in an office, or through teledoc. Outpatient services do fall under Part B. These are services rendered in an emergency room, urgent care clinic, or surgery center. Now, we must be aware that observation days in a hospital are also considered outpatient. This is often the cause for confusion, as observation can last up to 3 days, while your doctor decides whether you should be admitted or discharged. If you are admitted, Part A would take over. Other various services fall under Part B: labs, durable medical equipment, home infusions, walker, CPAP machine, etc. Tests and imaging are under Part B: MRIs, X-rays, as well as preventive care, well visits, vaccinations. Some home health services are covered as well if you are confined home and in need of treatment or therapy to help improve or maintain your condition. An ambulance, ground ambulance, is also covered under Part B. So what is your cost? Unlike Part A, which we know is based on a daily rate, Part B benefits are based on an allowance. The allowance is a fee calculated to be the fair market value of a medical service or item. After you meet the yearly deductible, $226 in 2023, Medicare pays 80% of this allowance to the provider. The 20% remaining balance is your copay. So let's say the allowance is $100. Medicare would pay $80 and you would owe $20 to the provider. Now do note that Part B usually covers 100% for labs and preventive care, for example, vaccinations. As for Part A, the role of a supplemental insurance is essential. Most Medicare patients have a secondary insurance to cover part or all of their financial liabilities. That secondary can be also called Medigap or supplemental. And depending on the level of coverage, that policy may pay part or all of your copays and even the deductible. Low-income seniors may qualify for Medicaid as that secondary plan. They are then called Medi-Medi or dual eligible patients. Medicare takes 14 days to process a claim, then sends it directly to your secondary as a courtesy, but you must accept when you first apply for coverage. There are, of course, some limitations and exceptions. The most important for Medi-Medi patients, that secondary coverage only applies and pays if the medical provider is contracted with or accepts Medicaid. This is too limited a number of clinicians, especially in some areas of the country. So if a provider is not contracted with Medicaid, they must bill you directly for the 20% copay and or Medicare deductible. If a patient can show proof of financial hardship, they can request a courtesy or hardship write-off. However, Medicare usually does not allow a deductible to be written off. For regular supplemental coverage, there are rules. First, be timely when purchasing your brand new policy. Penalties will apply if you do not pick a plan within the open enrollment period. And that enrollment period starts 6 months before the month you turn 65 and get Medicare coverage. While all plans in the country are standardized, Plan A, for example, offers the same level of coverage whether in California or Texas. They are administered by private commercial companies, HealthNet, Aetna, Humana, ARP, Cigna. Those companies only operate in certain areas. So your Plan F under Humana in Colorado may be the same as the one administered by Blue Cross Blue Shield in Arizona, yet not under the same insurance name. It will also likely be a different price. Your insurance agent or a Medicare navigator can help you choose the best plan. And now for some tips. Great news! Unlike Part A, the Part B deductible is only applied once a year. Do visit Medicare.gov. It is a treasure of information, simple and clearly accessible. The tab, What Medicare Covers, is especially easy to use to find coverage and pricing data. Comparing supplemental plans in your area, what they cover, and at what price is also easy to do on the website. Providers must be contracted with Medicare or accept Medicare assignments to get paid directly. If not, you must be informed in writing and sign whether you decide to go ahead, as your cost will be much greater than the 20% copay. Medicare.gov keeps a current list to help you locate a contracted physician or service provider. And let us not forget, we, patients, have rights. Insurance companies have a duty to their members, and they are mandates that providers must follow. I so thank you for watching this video. Did you know your likes, comments, and subscribes help this channel grow to reach out to many more patients like you? So, thank you.